if we're not treating the patients who have got prune belly by this method, which will make a big improvement, that's where we should start.
Mm.
When we run out of ammunition, then we can turn around and get somebody to transpose a muscle from one person to another. But right now, we can do it to the same patient.
Mm.
So we don't really need that.
Right.
Am I right in saying that?
It makes sense. Sure.
I think so.
Yeah. That makes sense. I'm trying to think what else they asked you.
Because the patient hasn't got the muscle, but we can take it from somewhere else, and he won't suffer anything from the loss of that muscle for there.
Right.
Because you've got other muscles that will take over. You have no deficits at all.
Mm.
But it is a valid point.
Yeah.
No one's looked into that.
Yeah. I had it. I was 15 when we had the surgery done, and at the time, he thought it was a good age to do this because they weren't sure about going much younger. Is that something you want to?
That's a very good point.
Okay.
Can I say this?
No, please.
I don't know the ideal age for doing it, because Frank is the only sort of youngster that I've done it on. The rest have been adults who've lost their abdominal wall for various reasons. So I don't know the age. It may well be you can do it on anybody, but it's a bit of an unknown. I would tend to suggest if you have a patient and the patient is very symptomatic, young person like Frank was, that you know you can do. Frank, you were how old then? You were 13?
I was around 15, I believe.
15.
Yeah.
Oh, well then I do it. I've done it all on adults.
Mm.
So I know the age doesn't matter. What's the earliest time you can do it? I don't know.
Well,
with dogs, with experimental animals, it grows. The transposed muscle grows the same as the dog's other muscles.
Right.
So that's and we rely on the animal experimentation quite a lot for various other advances in medicine,
right,
rightly or wrongly,
mm.
And so we know that to be true.
Yeah. I do know that, well, we are aware of another doctor in Dallas, Texas. His name is Jeffrey Fearon. And we've been made aware of him the last year and a half or so, that he's done it on a series of 1-year-old patients. And based on what Dr. Gerd did for me. When I spoke with him about a year or so ago, he was aware of the article that Dr. Gerd wrote on my surgery, but didn't actually read the article. Someone had made him aware of it, and he pretty much did his own version of that himself. And then we've all been in communication since then, which is pretty funny because 25 years apart, he knew about our surgery across the country from where we are, and here we are coming together now. So it's pretty amazing for that reason. And he has done, I believe it's about a half dozen now, around the age of 1, and some of them are now 7 or 8, and they're well on, they're fine.
Well, that's very significant, you see.
Yeah.
That's the population we don't know.
Right. Right.
But I'm sure we could go into Africa and whatnot and find many kids with it.
Oh, wow,
no,
yeah.
No, everyone's accepted it. That's what it is.
Yeah, right.
It's a birth defect.
Mm.
So we need the public relations. I don't know how far the Prune Belly Association can get also. You see, it's not easy.
Yeah, I mean, for us, for Prune Belly right now, for prunebelly.org, by the way, you can get that. Pretty much people who will search on the internet find the website, and then join the community, and then get information that they need to get from talking to people who have it, and talking to surgeons and that kind of thing. So they pretty much have to, well, I guess they pretty much have to find us first on the net, on the web, and then from there on everything becomes clearer and communication can really take off. Which is something I know that they're working on too, and that hopefully we can expand on, and which is the purpose of talking about it here. And
yes, I don't see a downside to doing it.
Right.
And as I say, I've done enough to show that nothing but good happens.
Right.
And we use it for many other things besides prune belly.
Right.
For missing parts, things, wounds that won't heal.
Yeah. At past conventions, I've gone to PruneBelly.org holds conventions every summer, and we've done them for the last 6 or 7 years now, I believe. And a couple of times we've had urologists speak about it, and 1 or 2 have actually mentioned this article on my surgery by name. Not my person's name, but by the name of the surgery and by Dr. Gur's name. And they said, well, we're aware of this kind of surgery being done out there, but we don't normally recommend it because it's not all that common, and we consider it kind of risky, and it hasn't been done enough, so we really don't even recommend it. We don't even offer it.
You see, that's a misstatement for people.
Yeah.
That doesn't help anybody.
Right. So I spoke up at 2 of them, actually, and addressed that without telling him, what my involvement with it was. And we kind of went back and forth about it, and he's like, I'm aware of this article, and it seems to be doing very well, and, the one person who had it done seems to be doing well, but again, it's so uncommon that we really don't say anything about it. And I finally pulled him aside after the public discussion and brought it up again, and I have the article in my briefcase, and I know, I'm very well aware of it, I know what it's like, and he says, the guy on the article looks like he's doing really well. And I said, that's where I have to stop you, doctor. I'm the guy in the article. And he went, what? He kind of like stopped at his tracks. And I said, yeah, see, this is the whole purpose of it. Here you are, now you see me, and now you understand what's going on. This, I don't know if you can zoom in on this, this is me before. This is at 8 months old. Where before, no muscle, urinary issues going on as well, with the tube and me and things. And and I couldn't breathe, I couldn't get up, I couldn't sit up. I had pneumonia 4 times before I was 4. And this changed all that. Dr. Gur's surgery, I remember him saying, was a 95% correction. Is that valid?
Say that again?
95% correction?
Yes, that's fine. Take 95%.
So in talking about that, the doctor I spoke with was interested, but he was kind of like, well, I'm not a decision maker, my hands are kind of tied, but maybe down the road something can happen from it. And left it at that. I'm like, oh, but take it a little further, But now with people like Dr. Fearon, that it is being taken further. And we're also recently, it's May 2009, where we are recently made aware of a doctor in Buffalo, New York, who's going to do one on one of our members' sons, who I believe is around 2. And that was because our members showed him Dr. Gur's article on me. And he's like, yes, I can do this. So that is what we need more of, to get this kind of work done. And again, not everybody may be capable or able to get it done, but overall, you think overall anybody can do it? Can have it done?
Oh, yeah. Yes.
Mm.
And if that was a factor, I would like to think that we would get such people and train them and meet them and tell them what to do. I wouldn't mind even looking over their shoulder and telling them what to do.
Yeah, right.
But it's simplistic. That's the other thing too. Mm. I'm a bit angry about everything because I'm frustrated because I have other things besides the prune belly that also people are not doing, like they're chopping off legs. Like I've got over here this